Nearly 9 in 10 adults in America have a tooth filling. Hi everyone, I'm Joyce the dentist. Tooth decay is statistically one of the most common diseases to affect children, but it can continue to impact people of all ages. Chances are, if you've never had a dental filling, you're definitely in the minority. Or maybe it's been a long time since you had a filling and it's time to get it replaced, but you don't even remember what the process was like. The good news is that if you're about to get your first ever tooth filling, it's a really routine procedure. Ultimately, you want your dentist to place your fillings in your teeth earlier while cavities are smaller, because once you have a cavity, it will just expand further and further into the tooth and sometimes even into the neighboring teeth. Now, there is confusion as to cavities that can be reversed, which is a whole other topic, but the short answer is that only cavities that are in the very beginning phases of demineralization can be reversed. Once it has passed into the dentin, it cannot be reversed and will only grow larger without intervention. The goal of a filling is to remove all of that infected dental tissue, rebuild your tooth, and restore your smile back to a healthy, stable state. Now, typically there are two types of dental fillings dentists will offer. First is the traditional amalgam version. Amalgam fillings are the metal or silver fillings that you've probably heard about. Even though they're not used as often anymore, a lot of people have them and they still serve important roles in certain situations. The second is a tooth-colored filling, or what we call composite restorations. These fillings are made of resin material with tiny little glass-like particles. The neat thing about composite is that it bonds to your tooth so that they're smaller and more conservative and help to preserve a larger area of your natural tooth structure. Most notably though, is that composite fillings are white and your dentist can select the best shade of resin so that it blends in with the rest of your tooth. That means you can get dental fillings placed almost anywhere in your mouth without them being visible when you smile. For my first timers, it can be really helpful to know what to expect as you go into your dental filling appointment. At this point, your dentist has already performed an exam, taken an x-ray, and diagnosed you with a tooth cavity. So this is usually a separate visit after your exam or checkup. Sometimes they can do it same day as well. Depending on the size of your cavity or how many cavities are being filled, your appointment is probably going to be anywhere from 45 minutes to an hour and a half long. Once you arrive, you'll get settled into the room with the dental assistant. They'll answer any last-minute questions that you have and then review what's going to be done that day. For most people, you'll have your mouth numbed with some local anesthetic by the dentist. To make sure that you're comfortable, the assistant usually rubs some topical gel on that part of your mouth, which provides some numbing effects. And after a few minutes, the dentist will step into the room and then gently inject some local anesthetic at the site to numb the specific tooth that's being treated. Honestly, a lot of dentists are really good at this, so you'll either feel nothing or at least just a little pinch that's kind of like a tiny bee sting. Next, you'll want to wait a few minutes for the anesthetic to kick in. Once you're completely comfortable, your dentist will clean out your tooth with a tiny little burr, and you'll feel a lot of water spraying and some vibrations from the drill. The assistant will also be suctioning and air drying as needed to keep that tooth nice and dry. Your dentist will keep your tooth isolated from others with some cotton rolls or what we call a dental dam. This is just to make sure the treatment field isn't getting contaminated and that you don't accidentally swallow anything. Once the cavity is cleaned out, your dentist will place the filling material into the prepped area. Then they'll use special instruments to shape or carve the filling material so that it rebuilds the natural contour of your tooth in that space. Amalgam fillings harden into place on their own, but white composite fillings are cured with a special light. In the case of an amalgam filling, your dentist will usually recommend not chewing on that tooth for the rest of the day. With white fillings, you are usually ready to go as long as you can eat safely with the numbing. Once your filling is complete, you can usually expect the anesthetic to take up to a few hours to wear off. Be sure not to eat anything hard, drink hot liquids, or chew on your lip accidentally while your mouth is numb. As the anesthetic wears off, you might start to notice a sore spot where the injection was given, so you can rinse with some warm salt water or take Motrin if you need to. And please check with your dentist if you're allergic to things like Motrin. Occasionally, for some people, there will be some tenderness in their tooth, especially if the cavity was really large or they needed to have the filling adjusted. If something feels off for more than just a couple of days, be sure to follow up with your dentist. They may just need to reduce that biting surface a little if the tooth is too high. If the cavity was large and your tooth is tender, it may take up to several weeks for that nerve to respond and pull back like we want it to. Again, stay connected with your dentist so that they know what's going on and can help you. Getting a filling is easier than ever thanks to a lot of new diagnostic tools and even laser technology that's out there. But waiting too long to treat your cavity could mean you wind up needing something more aggressive, like a root canal or crown. It usually boils down to how soon you treat the infection. And remember, there can still be a cavity even if the tooth doesn't hurt. All right, smile smarter, everybody. I'm Dr. Joyce. I'll see you next time.